Failed back surgery is all too common and devastating, which is why so many have turned to Dr. David McCord.
My daughter was 1 year old when I went in for my first back surgery. You almost have to experience nerve pain to understand what it's even like. Every time I drive down the road and see somebody holding their child, it made me envious because I couldn't do that. Now I can hold my grandkids, Now I've got a brand new back. My back's better now than it's been for the last 20 years.
If you're suffering from failed back surgery, visit failedbacksurgerymd.com today to see more real patient stories.
I had a laminectomy, and 2 years later I was back in the same shape again.
I've had 9 surgeries. I had relief for a while, and then I'd have to have more surgery to relieve the pain.
I had back surgery and they put some rods in and the pain started coming back. Other doctors, back surgeons, refused to even see me.
I've had 11 back surgeries. I went to the best doctors in the world, all the best doctors, and they just said there's nothing can be done. At that point, I'm suffering.
And I've had 7 spinal surgeries that have failed. Instead of saying that they just can't help you, they blame you.
Dr. McCord, he says, I won't give up. I'll find out what it is.
I have no idea where I would be today had it not been for Dr. McCord. My life was just restored.
You've had surgery. It's failed. You've had another surgery. It's failed. Consider coming to see me. I'll go through all of your studies. There's an answer. There is hope.
They were just going to keep me on pain medication, and then they put the pain pump in, and I had epidurals. Nothing helped, and they were just going from one extreme to another.
So I went to another doctor, and I had a morphine pump put in. He couldn't do any more for me, and he said I'd just be in a wheelchair.
I went to another doctor. They used to give me injections, muscle relaxers, and pain pills, and the only thing it did was just cover the problem up.
The roller coaster of depression, that's what the OxyContin will do for you.
I took injections, that wouldn't happen. I was on pain medication, so they was up in dosage of pain medication to stronger narcotics. And
he said, I'm gonna help you. I'm gonna find out what's wrong, and I'm going to help you.
You've been sent to pain management, where your life is essentially over because you're a legal drug addict. Consider coming to see me. There's an answer. There is hope.
What's going on with my back? I've gone to all these professionals who can't seem to figure it out. What's wrong with my back?
The first doctor that operated on me wrote me up as a malingural. The second doctor wanted me to see a psychiatrist.
When I was laying down, I didn't hurt. It was when I stood up or when I sat up. The best MRI is going to be one that you're in an upright position, because that's when the gravity's pushing down. But it made sense to me because my only way of getting out of pain was laying down.
And then when I came to Dr. McCord, and he put me through the upright MRI that I had never heard of. But it makes sense, because if your back is hurting when you're standing, that's where they need to be taking scans.
His MRI machine that he has shows the weight bearing on the spine. He was able to find that I had actually 2 discs that were bulging.
Dr. McCord put me on the upright MRI, and we saw the results. I'm grateful for the upright MRI. I got my life back.
Consider coming to see me. I'll go through all of your studies. There's an answer. There is hope.